Last week, the CDC released new guidance for things that people who are fully vaccinated can do. That includes not wearing masks in most settings and also returning to activity that people enjoyed prior to the pandemic. And so we're celebrating that move, and it comes on a collection of data over the past 3 to 4 months as more and more people have become vaccinated, looking at the effect of the vaccine on large populations and looking at who then gets COVID and who doesn't get COVID. And it's only in a few settings that people need to continue to wear masks if they're fully vaccinated. So those settings are healthcare facilities, schools, congregate settings like nursing homes or correctional facilities, homeless shelters, anywhere where there might be a large number of people who are especially vulnerable to COVID. We know that the vaccine is effective, but it's not 100% effective. And so we really need to protect in those high-risk settings from that low 5 to 10% of people that might still be vulnerable even though they've gotten the vaccine. So again, masking for people who are unvaccinated and vaccinated in healthcare facilities, schools, jails, nursing homes, homeless shelters. And if any store owner, business owner continues to make the request that people maintain that practice of wearing masks, we're recommending that the general population follow that request. If you look at our local numbers, very few people who have received the vaccine are getting COVID. The folks that are coming up with the new cases recently are unvaccinated. And we've really only had a few cases, 5 cases in the past 4 months of people who have been vaccinated go on to get COVID. So we're celebrating that as a success in the vaccine. And it makes us realize that now we can start to loosen up some of the recommendations and guidance for those individuals who are fully vaccinated. We're also celebrating that people who are fully vaccinated can travel freely. Traveling in the United States now doesn't require any quarantine before or after, doesn't require testing before and after. We've seen lots of people exposed to COVID after they've been vaccinated, and very few are contracting the illness. And so once you've been fully vaccinated, then you don't need to quarantine and you don't need to be tested if you've been exposed to someone with COVID. Now we have vaccine available to everyone 12 years of age and older, and they can go to the Okanogan County Public Health website or contact their healthcare provider to obtain that vaccination. So Okanogan County continues to see a rise in our cases, although it's a slow rise. We've seen 99 cases over the past 14 days, and that's slowly been increasing, but it's reassuring that we haven't seen a surge yet. And I think that's attributable to the vaccine and the fact that so many people are protected now. Close to 40% of people in Okanogan County are fully vaccinated, and that's keeping those numbers low. And as we continue to vaccinate more and more people, we'll be able to reduce the likelihood that we'll see a big surge that impacts the entire county. We have seen over the past 4 months that the number of new cases among people over 65 years of age has dropped off considerably. And the number of cases among those groups who have been vaccinated continues to go down. And so it's a sign to us that the vaccine is working. It's a tough decision to vaccinate yourself, and it's also a hard decision to vaccinate your kids. And I talk with a lot of families and patients in my own practice about that decision and see that happening between healthcare providers and the families that they care for all across the county. And I really support the good communication and decision making. I think it's a good thing to ask your healthcare provider, ask your family doctor, or ask your primary care provider what they think about you getting the vaccine. Is it safe for you? We know that for the general population, it is a very safe vaccine. The most common side effects being a mild fever, pain at the injection site, body aches, chills, feeling sick for a day or two because the immune system is responding. We're watching very closely the reactions that people have, whether it's a local reaction or a the feeling sick type of reaction, and reporting on those and collecting data on those. I think the vaccine is the single most powerful thing you can do to protect yourself from COVID. We can wear masks, we can distance from one another, we can not leave our house. We can do those things to keep ourselves protected. But as we've seen over the past year, it impacts our mental health, it impacts our financial health, and it impacts the well-being of our family. And so I'm glad that I'm beyond that, that my wife is beyond that. So for us, and like many other people I've talked to, life after the vaccine is much more like life as we knew it before all of this started. Whether or not we have variants in Okanogan County is a very good question. We know from sequencing a small number of cases that we do have the variant that's from California and the variant that's from the United Kingdom, the B117 that gets so much attention, are both present in Okanogan County. Vaccine works very well for B117. It works very well for the California variants. And it's interesting that the eastern counties in Washington are seeing more of the California variant, whereas western Washington counties are seeing more of the B117 variant. And I think that reflects travel patterns. We do know that the B117 variant is more contagious than the California variants. And as predicted, we're seeing the B117 variant become the predominant type of virus in the state of Washington. It doesn't mean we do anything differently. We just do what we know we do, and we do what's been effective thus far, and that's masking, distancing, and last but not least, and most effective, getting vaccinated.